Congress just passed the Inflation Reduction Act. And if you are currently on Medicare or will be going onto Medicare in the next few years, there's some important information in this act that you need to know. So stay tuned. Hi, I'm Jessica Mannion with My Healthcare Direct, and today I'm going to go over the changes that are going to occur to Medicare as a result of the Inflation Reduction Act being passed. This act will have an impact on Medicare's prescription drug costs for future years. Here are 8 ways that it could affect you in the future. Number 1, Medicare will begin to negotiate the drug prices for qualifying prescription drugs. Starting in 2026, Medicare will negotiate the price for 10 prescription drugs, then 15 drugs in 2027 and 2028. Then it will increase to 20 prescription drugs in 2029 and ongoing years. If you are taking one of these prescriptions, you should start to see the cost being reduced starting in 2026. The new cost of the drug will vary depending upon the drug and the negotiated rate results. Number 2, starting in 2023, out-of-pocket costs for covered insulin products will be capped at $35 a month. Number 3, out-of-pocket drug costs will be capped at $2,000 effective 2025. This will be a big change for those who are on expensive medications. This means that starting in 2025, once you hit your out-of-pocket maximum, you will not owe any additional copays or coinsurance for covered drugs for the remainder of the year. You will still have to continue paying your prescription premiums if you are enrolled in a standalone Part D prescription drug plan. The out-of-pocket cap can increase in the future years based on Medicare's annual spending for covered drugs. For example, if Medicare spends 5% more, then the cap for the following year will be 5% higher, which equals to $2,100. Number 4, drug price increases cannot exceed the inflation rate. So starting in 2023, drug manufacturers will have to send Medicare a rebate if the prices of most covered drugs on Medicare go up faster than the rate of inflation. This means that you may see drug prices increase at a slower rate than you've seen in the past. Number 5, full extra help subsidies will be more available to beneficiaries. While in the past, to qualify for a full subsidy for extra help, you had to be below 136% of the federal poverty level, starting in 2024, if your income is below 150% of the federal poverty level and your resources are below certain thresholds, you may be able to qualify for extra help for your Part D drug costs. This means that those of you who previously were not able to qualify may be eligible in the upcoming years. Number 6, Medicare Part D premium increases will be limited starting in 2024. These plans cannot increase more than 6% per year. This means that those of you on a standalone Part D prescription drug plan will not experience higher rate increases like you may have seen in the past. Number 7, adult vaccines will not require cost sharing starting in 2023. This means you can get a vaccine that is covered by Medicare Part D without any out-of-pocket costs. Number 8, catastrophic coverage will no longer require coinsurance. Currently, once you reach the Part D catastrophic phase, you will have spent approximately $7,050. Then your drug costs are drastically reduced 5%, or a minimum of $3.95 for generic and $9.85 for brand name drugs. Starting in 2024, once you reach the catastrophic phase, you will no longer be required to pay coinsurance, and you will not have to pay any more out-of-pocket costs for covered drugs for the remainder of the year. Now, this provision mostly applies to 2024 because in 2025, That is when the prescription drugs are capped at $2,000 for the year. So here's a quick summary of all of these Medicare changes and the years they go active. In 2023, drug companies are required to pay rebates if their drug prices rise above the rate of inflation. Covered insulin products will be limited to $35 co-pays per month, and adult vaccines that are covered under Medicare Part D will be available at no additional cost. In 2024, the 5% catastrophic phase will be eliminated, and eligibility for Part D low-income subsidy with full benefits will be expanded up to 150% below the federal poverty level. Also starting in 2024, all the way through 2030, there will be limits on the Part D premium growth to where the premium cannot increase to more than 6% per year. In 2025, the Part D drug cost will be capped at $2,000 for the year, and in 2026, there will be 10 Medicare Part D drugs that can be negotiated. In 2027 and 2028, that number increases to 15 drugs negotiated. And finally, in 2029 and onward, there will be 20 Medicare Part B and D drugs that Medicare will be able to negotiate. If you have any more questions on how these changes may affect you, feel free to give our office a call, or you can send us an email and we'd be more than happy to answer your questions. And make sure to subscribe to our channel for all the latest Medicare updates.